My name is Dr. Srivastava, and I am an imaging person and a clinical cardiologist. The concept of heart failure is rampant, it is increasing like an epidemic, and it is very necessary that we must diagnose this, treat it, otherwise the burden of this heart failure is going to hit the community so bad that we will not be able to handle it. The topic which I am discussing today is how to diagnose heart failure by echocardiography, especially the type of heart failure which has got normal contractility. So essentially there are two types of heart failures. One is when the contraction of the heart becomes weak, and second is that the contraction of the heart is well preserved, but because of the filling pressures being high, which happens because of some kind of a stiffness to the left ventricle or the major pumping chamber of the heart, there is an increase of filling pressures which translate into shortness of breath and heart failure with preserved ejection fraction is the name we give for that. Having said that, what is the most essential diagnostic criteria? The most essential diagnostic criteria besides the clinical features are echocardiography. So echo gives you a reasonably good idea about what the filling pressures are like, what the congestions is expected to be in the lungs, though it has its own limitations, but as a start point for finding out the definition of what kind of a heart failure it is, echo is very important. For finding out what is the etiology or what is the cause for it, echo can be a reasonably good modality. And lastly, if you want to see what is the improvement which is happening with medication, therapy or devices or surgery, then echo is the therapy. This is essentially the talk of the day which I am going to discuss. Thank you.